Well, we turn our attention now on a common medical problem that you or your loved one may be experiencing. It's called varicose veins, and this disease affects as much as 30 to 60% of the population. The incidence increases with advancing age. Now, this disease is more than cosmetic, with most patients report symptoms that range from mild to severe. Common symptoms include aching, pain, burning, cramping, throbbing, leg fatigue, and swelling. The Colorado Center for Photomedicine is a nationally recognized leader in light-based medical therapy, having received numerous accolades, including Best of City Search and Center of Excellence for Luminous Lasers. Dr. David Verbally is here. He's the Chief of Laser Surgery at Colorado Center for Photomedicine. He joins me this morning.
Morning.
How are you?
I'm doing well. How about you?
I'm doing good. You came on a good day. We have a lot of fun action stuff going on a little bit later. But first, let's talk about the vessels. What happens? What causes varicose veins?
Sure. When we look at vessels, we actually kind of determine them by size. It ranges everything from the little tiny telangiectasia, these little 1 millimeter vessels that you'll see on the face or on the legs that kind of are associated with pregnancy or genetics and UV light exposure, to the reticular vessels that you see on the legs. These don't bulge. They're bright red or purple. They're kind of unsightly, but they don't necessarily hurt. And then you get to the varicose veins. These are the ones that actually bulge. They cause pain, they cause swelling, a lot of heaviness in the leg. Those are what actually happens when the valves inside the vessels fail. And what will happen is your body has a couple of unique mechanisms to get blood back to the heart. It has to pump against gravity. Well, it uses your calf. That's kind of like the heart of the leg. Pumps everything north and gets it back to the heart. The other mechanism it uses is the veins have little one-way valves in them. So the blood goes up, the valve closes, it's not able to fall back down against gravity. When that valve gets diseased, it starts to open up. Blood will start to fall back down. It'll start to push the vessel out, widening it up, causing a varicose vein. Well, that makes the next valve down. Open up, widen out. Sooner or later, you get a long, ropey vein.
Yeah. Well, how do you know what treatment is right for what vessel?
Sure. When we look at the smaller vessels, we look at lasers. They work very well. Simple, effective 2 or 3 treatments, those can go away. When we look at reticular veins, the ones in the legs here, we tend to use either deeper penetrating vessels, or we can also use injectable solutions like sclerotherapy that will make those go away. For the varicose veins, it's a little more difficult. We tend to use the endovenous procedures. That's become the standard of care. And this is where we take a little fiber, which I actually brought you with this so you guys can see how tiny this little fiber is. I'll even let you play with that. And you can see that's only about 0.5 millimeter. And what happens is we actually put that fiber inside the vessel, and we use a light to actually toast the vessel from the inside out. Causes very little collateral damage. Patients are back to their feet the same day.
Interesting. Gosh, this is just amazing. So very, very tiny. And aside from varicose veins, what are some signs that we should be aware of for vein disease?
Sure. Not everybody has big, painful varicose veins. But in patients that experience pain or swelling or even just aching in their legs after standing, that's a sign. The other thing that you can see sometimes is some patients just say they feel heaviness in my legs. And when we look at their vessels under ultrasound, we'll see these things. Any kind of discoloration or wounds that don't heal around the ankles are also important. If any of these things are happening, it's really important to get to a doctor and actually have them look at your vessels with an ultrasound.
Is the treatment painful?
No, not at all. Our patients are awake. They're totally with it during the procedure. Procedure takes about 30 or 40 minutes. Legs a little bit sore for probably about the next week or so, but you're back to your feet the same day. We actually encourage our patients. There's no downtime. We actually don't want our patients sitting. We want them up and moving them around.
Excellent. That's great. Again, you can look at the bottom of the screen. I'm going to give you a phone number that you can contact here in just a few moments if you're suffering from vein disease, varicose veins. And what's the difference between the Cool Touch laser and also other varicose veins treatments?
Sure. So the Cool Touch laser, that's what this little fiber that you saw over here was for. The older way to treat vessels, and we were talking before the show that you've had family members that have had vein stripping. This is where you go into the hospital, they put you under general anesthesia, and the surgeon physically rips the vessel out. That causes a lot of damage. There's a lot of downtime, a lot of side effects, nerve damage, things like that. And it's not all that effective when you compare it to the endovenous procedures. The older lasers will tend to target blood, and there tends to be a lot of collateral damage. They can cause bruising, swelling, nerve damage. With the Cool Touch here, it actually targets water, so it eliminates that collateral damage. It's just a really nice combination of a finesse procedure where it also acts as a very effective procedure.
Wow, look at these before and afters. My husband, he has varicose veins right behind the knee that you saw the very first picture.
Yep.
How many procedures does this typically require?
96% of the time you're done in a single procedure. It's extremely effective. And like I said, very little downtime. The nice thing about it, too, is most of these procedures are covered by insurance.
Oh, excellent. Well, we need to come see you as the couple. Mike has like varicose veins, and I have rosacea. I understand you can do something with rosacea.
We can. And you know, rosacea, there's a big kind of conglomeration of what rosacea encompasses. Everything from mild flushing, we see tiny little vessels on the nose, and you see the big flushing on the cheeks, to people that have a real big overgrowth of their sebaceous glands. They'll get the big bulbous nose. You know, we normally don't see it before about the age of 30 because it takes a combination of environmental factors plus genetic factors. In some cases, there's even infection that's involved. For the patients that just have a little bit of flushing, a couple pulse dye treatments. This is a no downtime treatment. Takes about 15, 20 minutes in the office and you're done. 2 or 3 of those and you're looking a lot better. For the patients that have a lot of breakouts and acne and stuff with this, we'll put those patients on antibiotics too. For the patients that have gone a long time without treatment and they have this what's called rhinophyma, the big bulbous nose, that requires a little more. We actually take a CO2 laser to actually reshape the nose on top of using the pulse dye laser to clean up the redness and the antibiotics.
Yeah, I have a little broken blood vessels right along my cheek and my nose.
Yep.
What is port wine stains and the treatment?
Yeah, port wine stains, this is another common vascular thing that we see. It affects about 1 in 200 people. And what it is, it's just an overgrowth of capillaries. They're present at birth. Normally we see these things get worse, not better. That's the unfortunate part. When the patient's a child, it'll be kind of pink, but they tend to get darker and thicker. They can become disfiguring, especially if they're around the lip, and develop areas that bleed. So they can be actually pretty difficult. Ideally, we like to actually treat these patients when they're young, before 6 months of age. I have patients right now in my practice that range everywhere from about 8 months all the way to 55 years.
Wow.
So you can treat them at any time. There's a lot of different treatments for these. The pulse dye laser is probably the main one. The newest version of it actually is really great because it's a lot more powerful and it can treat a lot of people that their port wine stopped responding to the older lasers. And then on top of that, we've got 3 or 4 other different lasers, just kind of depending on what the patients had done before, kind of how deep, how dark, how their lesion is.
What other vascular lesions do you treat?
We treat, if it's red, blue, purple, we probably treat it. Yeah. The most common thing that we treat are little things like cherry angiomas. These are the little red dots that you get, and we get them as we grow older. They're just little balls of capillaries. Single treatment, gone. No downtime, no nothing. Simple, cheap, and easy. The spider angiomas are a little bit like the same, a little red dot, and they've got little tracking vessels that come out from those. For the venous lakes, these are going to be kind of purpley blue. They show up on the face, a lot of times on the lips. They can actually actually mess people up when they're trying to eat or talk. Those require a couple more treatments, but can be very effectively treated with lasers. And then we also do hemangiomas. These are going to be big red spots, normally in kids. They start to actually show up as a white spot when the child is 2 to 4 months and kind of grow. They will tend to go away on their own, but if you leave them, they tend to cause scar tissue. So if you manage them with laser, decrease the size of those, they tend to do much better.
Good to know you can start at a young age. And finally, doctor, what sets you apart from other laser companies out there, and what kind of special do you have for our viewers?
Sure. We actually do a lot of this. That's kind of our main thing. All we do is light-based medicine. We're a center of excellence for the laser manufacturers. We actually teach for a lot of the laser manufacturers, too. I was actually lucky enough to be invited to become training faculty for the American Society for Lasers in Medicine and Surgery. Actually helped them develop their certification exam. The neat thing about that is ASLMS is a really unique organization. They have surgeons, they have plastics, they have derm, they have research scientists. So you get this amazing conglomeration of people. So I get to work with the guys from Harvard. I get to work with the guys from Hopkins, in developing these protocols. And we just have a lot of neat equipment in our office. We're the only place in Denver that has the Cool Touch laser. We're one of the only places in Denver that has the new Perfecta, the new pulse dye laser. And we just always have the right tool for it. So no matter what walks in, we're able to treat it. And we spend a lot of time with our patients. I book hour-long consults so we can make sure that we answer all your questions, that we go over everything, that we provide you all your options, and that way our patients can really make an educated decision.
You are very impressive, very educated. Thank you very much.
Thank you so much.
We have some great specials I want to tell you about. Now, the Colorado Center for Photomedicine is a nationally recognized leader in light-based medical therapy, and they invite you to join the long list of patients who have found a solution for their varicose veins. The phone number you need to call right now, 303-683-3235. You can also check out their website at coloradoskincare.com. Now, as a special offer for you, our Colorado and Company viewers, the first 25 callers will receive your choice of a free ultrasound. Now, that's a $175 value, or you can get $50 off any treatment. Don't delay. Do it right now. Call 683-3235. Mention that you saw Dr. Verbally right here on Colorado and Company. The number again, 303-683-3235. You can go online to coloradoskincare.com